we will be ready with a particular plan.
We invite you to share your thoughts and questions using the hashtag KYDebate on Twitter. Kevin Kays wants to know if the candidates would support medical marijuana for patients with epilepsy, cancer, and other medical needs. Mr. Conway.
I do not support medical marijuana. Now, let me be clear. I've supported cannabidiol and some of the oils that deal with seizures. I even worked with Commissioner Comer to help market hemp. But I am not a supporter of medical marijuana. Medical marijuana is the only medicine I could think of that would be prescribed in joints. Secondly, I've been in front of 45,000 kids all around this state talking to them about the dangers of prescription drug abuse. And when I've met addicts or people that are having problems in their families, it always seems like it started with marijuana at an early age. And finally, Vicki, and most importantly, I worked in a bipartisan fashion a few years ago to pass House Bill 1. It gave us new tools to shut down half the state's pain clinics and to actually get our doctors to check Casper. The Kentucky Medical Association, which represents the doctors, lobbied us so hard on that. They were waiting outside of my office. I have not heard the first thing from the Kentucky Medical Association or the medical community that says that we need medical marijuana. Until I hear from them, I'm not going to be for it.
Mr. Bevin.
The question was asked about the support of medical marijuana. I would sign such legislation. I do think there's unequivocal medical evidence of the fact that there are benefits for some of the very folks that you've described, those with cancer, those with epilepsy. It's unequivocal. I think it should be prescribed like any other prescription drug. I think it should be regulated in the very same fashion. But if in fact it were, then I would in fact sign such legislation into law. With respect to recreational marijuana, which is what I think you were referring to when you talk about how people start on drug problems, this is a very different story. A kid with epilepsy, a kid with terminal brain cancer, these are not kids that I'm worried about starting off on a life of drug addiction. These are kids who need help. And I would absolutely sign such legislation, but I would never, ever in this state sign legislation encouraging the use of recreational marijuana.
Well, let me just say this. I was talking about medical marijuana. And if we passed a law for medical marijuana, it would be easier to get on our streets. Okay? And when you talk about our kids, look, I've been in front of 45,000 kids the last few years. I heard we lost an entire generation of prescription pill addiction, so I went on the road with two mothers from Moorhead who lost their own children. I've had children cry on my shoulder in our high schools because of what they're facing. I understand what hurts kids, and I don't want to do anything that would have the potential to hurt our children.
I want to make one final comment to this, because I'll tell you, we're on the campus of a university, and I'm not going to ask for the young people in this room to raise your hands, but is it not already easy for you to find this on the streets? Come on. Who are we kidding? The only people who can't get it are the people who abide by the law. The only people who can't get it are these families who want some medical relief for members of their family. The idea that we're saving this from getting out on the street, Jack, is a tremendous misunderstanding of the question that's being asked.
All right, another question now submitted on Twitter.